Hey everyone, welcome to this informational video on osteoporosis, a condition impacting millions globally. Today, I'll walk you through the causes, symptoms, risk factors, and treatments for osteoporosis. Whether you're here for personal reasons, academic curiosity, or to help someone you know, this video has got you covered. So what is osteoporosis? It's a bone disease where the body loses too much bone, makes too little bone, or both. Picture healthy bones like a dense honeycomb. In osteoporosis, that honeycomb structure becomes more porous, weakening the bones and making them fragile. Let's dive into the causes. First up, aging. As we get older, our bone mass naturally decreases, making us more susceptible. Then, there are hormonal changes. For women, a drop in estrogen after menopause significantly raises the risk. Men aren't off the hook either. A decrease in testosterone can also contribute. Nutritional deficiencies, especially a lack of calcium and vitamin D, weaken bones. A sedentary lifestyle reduces bone strength, while certain medical conditions like rheumatoid arthritis, thyroid disorders, and cancer can also play a role. Long-term use of medications like corticosteroids and some anti-seizure meds might increase the risk. And don't forget genetics. If osteoporosis runs in your family, you might be at a higher risk. Now let's look at the risk factors. Age is a big one. The older you get, the higher your risk. Gender is another. Women, particularly post-menopause, are more likely to develop osteoporosis. People with smaller, thinner frames have less bone mass to draw from. Lifestyle choices matter too. Smoking, excessive alcohol intake, and poor diet increase your risk. Osteoporosis is often called a silent disease because it doesn't show symptoms early on. But as bones weaken, signs start to pop up. These include back pain from fractured or collapsed vertebrae, loss of height, a stooped posture, and fractures in the wrist, hip, or spine, even after minor incidents. If you or someone you know experiences these symptoms, seeking medical advice is crucial. How is osteoporosis diagnosed? Doctors often use a bone density test, known as a DEXA scan, to assess bone health. This painless test measures bone mineral density and helps determine fracture risk. While osteoporosis can't always be fully reversed, there are effective ways to manage it and improve bone strength. Medications like bisphosphonates can help slow bone loss. Hormone therapy might benefit some postmenopausal women. Newer options like denosumab and teriparatide are available for those at high risk. Nutritional support is vital. Boosting your intake of calcium and vitamin D can strengthen bones. Foods like dairy products, leafy greens, and fortified foods are excellent sources. Exercise is also essential. Weight-bearing activities like walking, jogging, or dancing improve bone strength. Resistance training helps build muscle, which supports bone structure. Lifestyle changes like quitting smoking, limiting alcohol, and maintaining a healthy weight are key to protecting bone health. The best way to combat osteoporosis is through prevention. Ensure you're getting enough calcium and vitamin D in your diet. Engage in regular physical activity, especially weight-bearing exercises. Avoid smoking and limit alcohol consumption. Get regular checkups, especially if you're at higher risk. Osteoporosis is a serious condition, but with the right knowledge and lifestyle choices, it can be managed, and in many cases, even prevented. If you're concerned about your bone health, consider speaking with your doctor about screening and preventive steps. Stay healthy, stay informed, and take care of your bones. Thanks for watching.